Some people think the plant-based whole foods diet is extreme. 500,000 a year will have their chests opened up and a vein taken from their leg and sewn onto their coronary artery. Some people would call that extreme. That is Dr. Caldwell Esselstyn, who is one of the preeminent cardiovascular surgeons on the face of the planet at Cleveland Clinic. And he was one of the first guys to willingly come out and put himself up and say, you know what we're doing is wrong. I'm going in there and I'm performing surgery every single day, opening up people's chests, and I finally have to say that every single thing I've done is completely preventative. This seminar is kind of close to me for a couple reasons. The first one is I grew up, my grandmother passed away of her third heart attack. I found her. And I had to give her CPR, which was not fun because I knew she wasn't coming back. At that time I was in college, and she was basically like my second mother. I spent a lot of time with her growing up. And I got into my mid-20s, graduated school, went out into the business world, not even thinking about doctor yet. And living the life, I worked in the sports field, and in my mid-20s, I started having heart attack symptoms. And keep in mind, I just lost my grandmother. I had other people impacted in my family with cardiovascular disease. And I'm having heart attack symptoms in my mid-20s. And when I say heart attack symptoms, I mean extremely high anxiety, chest pain and tightness going all the way down my arm, into the back of my shoulder. Pretty scary, especially when you're mid-20s. I went to a physician at the time, a medical doctor. I lived in Boston, and I went there for my heart because I was a little concerned. And I went up there, and she said to me in the exam, and all I said was, "Yeah, my family has cardiovascular disease, and I'm a little worried about my heart." She asked the magic question of, "Do you ever get anxious?" I said, "Yeah." That was all she asked. She referred me out to a psychiatrist. That's fine. I went there not knowing anything about the health world or anything about the field. I went there within 2 visits, maybe half an hour each at most. He gave me a little form to fill out, which is a questionnaire, pretty easy to fill out. They put me in the 90th percentile of ADHD. Here's your drugs. I took those for a day. So I have no idea what cocaine, LSD, any of that stuff's like. But I can tell you, I think I know what it's like. Because when I went on those drugs for one night, Zoloft and Adderall, I thought I was on drugs. But going forward, I moved here, got my wife, and was still having chest pains. Anxiety getting worse, depression getting worse, etc. And I said, you know what, I'm going to go to a cardiologist. My wife's a chiropractor, so not that she doesn't like cardiologists, but she's saying, what's the cause of it? You know, we got to find out what's the root cause. And so she goes, go, because I know it's going to make you feel a little better and get some, peace of mind. So I went, told them what I had, and they set me up for the stress test. You know that, right? You know what the stress test is? So they didn't give me the in-depth one where I had to go home with something on me. They gave me the treadmill. And I'm on the treadmill, going, and I'm like, keep going up, and they just said, well, let us know if you can handle more. Keep going up. So within about 15 minutes, I was actually sprinting on the treadmill. And the nurses were actually not really sure what to do because they'd never seen that. They don't have 9-year-olds sprinting. So I was sprinting on the treadmill. And they had this kind of white look on their face. And I looked over and I'm like, what's going on? Well, I walked in with what's called a preventricular contraction. So the bottom 2 chambers of my heart basically skipped. My heart would stop and kick back on and stop. I had it my whole life that I knew. I was told it was hereditary. So as I'm doing this, they looked at me and said, we've never seen anything like this. Like, as I'm sprinting, I'm talking to them. Like, what is it? My heart started beating normally. Preventricular contraction disappeared. Okay? So, now logically, I have to go, my heart is skipping, but when I'm running and exercising, it goes normal. Does that kind of put off an alarm bell in anybody else's head besides me? Like, wait a second, that doesn't make any sense. I went in, the doctor came in, He came in and sat down. He spent literally less than 2 minutes with me. Okay? He immediately handed me what's called a beta blocker. Never once said anything about diet. Never once said anything about exercise, even though I just sprinted on a treadmill and overturned my heart condition, right? Never did anything like that. So later on, I did some adjustments, things like that, and helped it a little bit. But then it was about time to really check out the lifestyle portion. And then that's when we actually found what we do in this office, which is nutrition response testing. So we found it. I went in. The person who tested me, who is actually a personal friend of mine now, I didn't tell her anything about myself because I was a skeptic. I didn't want to believe that something other than our Western medicine paradigm could change somebody or could help somebody. So I didn't say a word. Went up there and she said, my heart was totally weak. And she said, do you want to have kids someday? I said, I'd love to. Do you want to have a family? Love to. You're not going to if you keep on this road. And she said, how much do you like sugar? And I said, I'm not telling you. Not until I actually did this that I fixed all of those problems. So today, I can tell you, not in like the last maybe 10 years it is now, have I ever had a heart symptom. I don't have pain, I don't have the chest tightness. So that's my story and how it's changed my world. So heart disease facts, about 600,000 people die of heart disease in the United States every year. That's 1 in 4 deaths. That's pretty impactful. 1 in 4 people are going down because of heart-related deaths. It's not good. Heart disease is the leading cause of death for both men and women. So the big words you hear today are cancer, diabetes, etc. They sound like everyone's coming down with cancer, correct? Yeah. Mm-hmm. Heart disease even bigger. It's the most prescribed drugs out there. The statin drugs, you know what one of their side effects are? What are the biggest side effects of statin drugs is? Muscle weakness. We're giving you a drug that has muscle weakness as a side effect. What's a muscle?
Heart. The heart's a muscle.
Right. Cholesterol, big one in the news all the time. Is cholesterol good or bad for your heart? What is cholesterol? So I can guarantee most people hear the word, they know the word, it's a buzzword, but they don't know what it actually means. So we put something there for you. Cholesterol is a substance present in all animal cells and bodily fluids. We're animals. That's what we're classified as on this planet. It's a potent antioxidant that fights free radicals in the blood and helps heal arterial damage. Cholesterol goes in, it makes up every single cell of our body. So when you break down the body, tissue, organ to the cell, which everything's a cell, we're made up of millions of, or trillions of cells. Every single cell wall is cholesterol. So they're telling you cholesterol is bad for you. If you don't have cholesterol, your cell wall will break down. 1/2 of the brain is made out of saturated fat for nervous system function. What do you think makes that? Cholesterol. Cholesterol guides all that process. Our brain is fat. Cholesterol is just kind of a fat, basically. You must have cholesterol to produce hormones. So saturated fat helps stop inflammation. You cannot have sickness in the body or disease in the body without inflammation. Cholesterol, saturated fat help bring inflammation down. Without inflammation, I guarantee you won't have sickness. Does meat cause heart disease? Everyone wants to know that today. If you're going to eat meat, I urge you to do grass-fed meats. Cows were never intended to eat corn. They were never intended to eat grains. They were never intended to be shot up with antibiotics and hormones and steroids. They weren't, but that's all of them. They work, okay? When you eat that, you're getting everything the cow got. I love meat, okay? You have to do it in moderation. So the old palm that they talk about, the size of your palm, it's really about ideal. If you could eat organ meats, even better. So organ meats, they're very hard to find today, but they are the best. How do you prevent heart disease? So you can prevent heart disease. Now, genetics was brought up earlier, and I will always talk about genetics. However, and I'm not just saying this because it's my opinion, it's backed up by facts now in the last, say, 5 years. Genetics is only about 5 to 10% of the equation now. Before it was said as 100%. So preventing, eat whole food. So like my quote in the beginning, this refers to food that has been processed or refined as little as possible and is free from additives or artificial substances. Consume full-fat milk products from pasture-fed cows, preferably raw and or fermented, such as raw milk, whole yogurt, kefir, cultured butter, whole cheeses, and sour cream. People don't get sick from raw milk. You know why? Because the people who are doing the raw milk have cleaner facilities than the factory farms that are doing pasteurized milk. And when you pasteurize milk, you destroy everything in it. Use traditional oils like extra virgin olive oil, sesame oil, flax oils, coconut oils, and palm oils. Make sure they're expeller pressed or cold pressed. The one thing I will change on, not change, but just let you know, I'm not a big fan today, from what I've read, on heating or cooking with olive oil anymore. It makes it go rancid, it oxidizes it, not necessarily a good thing. Put it on your salads and all that, great. Absolutely great. I wouldn't personally cook with it today. You can. It's not going to destroy it all, but it's just not, like coconut oil is the king now. Cooking with coconut oil, butter, those are the kings now. Prepare homemade meat stocks from bones of chickens, beef, lamb, and fish and use in soups, stews, and gravies. This is amazing now. This is becoming more popular because we're actually boiling the minerals out of the bone marrow of the actual bones, and this actually heals the gut as well. Very good for us. Make your own salad dressings using raw vinegar, extra virgin olive oil, and expeller pressed flax oil. Those are all great. Get chiropractic care to take pressure off the nerves, going to your heart, and optimize your immune system. So obviously this is very important to me as a chiropractor. Many people don't really understand the founding of chiropractic because it's become such a pain thing today. You know, get out of pain for you to go see your chiropractor. That is not what chiropractic was founded upon. Chiropractic was founded upon adjusting the bones in your spine because those bones house your spinal cord going to your brain. Out of that spinal cord comes nerves. Those nerves go out to organs. And then use nutrition response testing practitioner to prevent heart disease and giving your body what it needs nutritionally. So, this is what we talk about. The heart needs nutrients. Okay, whether you're on a medicine or whether you have it in your past, your history, your family history, whatever it may be, you have to get your heart working again. You have to give it nutrients. Can an organ work if it's not fed? No. What is the building block to life? What must you have to live other than water? Food. What are we getting out of food? Where does the energy come from? Nutrients. Right. Vitamins, nutrients, minerals. That's what we must have. This is the foundation of nutrition response testing and why we use it. And it aligns with our chiropractic philosophy, which is holistically work on fixing the body and the immune system preventatively.